Newfoundland and Labrador is dealing with an acute shortage of registered nurses. Now, that's a problem being experienced right across the country, but in Newfoundland specifically, there are hundreds of vacancies and hundreds more nurses eligible to retire. One nurse in a rural part of the province is speaking out, saying the system is broken and the government's solution may not do the job of fixing it. Ariana Kelland reports.
As an ER nurse with 2 kids, there isn't much time to stop and take a breath.
It's a lot of broken promises. So it's a lot of, I'm working tonight and tomorrow's the last day of school and I'm gonna come home and I will take pictures and I'm gonna drive you to school. And then the next morning comes and there's a sick call.
She loves her work, her co-workers, her patients. But for too long, Byrne says she's been fitting her life between shifts, or between mandated overtime.
You ask for a day off 6 months in advance, but there's nobody to take that day. There's no staff to cover that day.
Last year, Byrne decided to quit her permanent job and went casual. She got to keep the job she loves, but could schedule her life and keep those promises. A recent survey of local nurses shows she is far from alone, with 50% indicating they were considering doing the same. To fill the gaps, the province's regional health authorities have started using private travel agency nurses, spending over $1.5 million in 6 months.
This is public money for a publicly funded healthcare system being spent on private industry.
Yvette Coffey says the province needs to invest in the nurses still in the system.
It's a slippery slope because our members want flexibility, our members want time off. And they see this, and we have people leaving our system now to join agencies in other provinces.
I respect and appreciate the health authorities using creative approaches to fill the gaps. However, we need to recruit, we need to retain.
The health minister says an announcement is coming soon to help alleviate the strain. But without changes in flexibility, staffing, and incentives, and fast, Byrne says that will be difficult. For now, she knows she made the best decision for herself and her children.
When I told my kids, my little girl who's 10 started to cry. And I don't think I realized and she kind of said, so you'll be home for my birthday.
Ariana Kelland, CBC News, St. John's.